scrub up well. We do everything that's focused on this area, and we do non-surgical treatments for this area. So that includes toxins, fillers, and we do skincare. What are the risks?
Different things have different risks. The toxin treatments we do for wrinkles and for lifting the face, they wear off after 3-4 months, so the risks are minimal. With the fillers, we're extremely experienced with it. In fact, Rachna sits on the International Advisory Board for Complications, and so knows how to deal with just about anything.
What is the light treatment? Oh, Jonathan, tell us about the light treatment.
So we've invested a lot of money into something called the Optilight IPL, and it allows us to treat rosacea, dry eye, blepharitis. A lot of people suffer with watery eyes, dry eyes, and we actually have an effective treatment for it, which can make you drop free. What can you do for your skin?
Oh, that's a great question, because with every consultation we offer a complimentary skin analysis, and then we're able to prescribe medical grade skincare that's directed towards your individual skin. What is the downtime?
What is the downtime? So we've been doing this for many years now, and we learn from every patient. We have gotten downtime down to the absolute minimum. We hardly bruise our patients, they have minimal swelling, and we have lots of secret tricks to achieve that.
What are the risks of blue light?
I mean, blue light basically resets your circadian rhythm and can make falling asleep difficult.
What is the microbiome? We all have a colony of bacteria and viruses that live within our gut, on our skin, on our eyelids. And if the microbiome is upset by antibiotics or the environment or anything that we do, pollution, then it can cause inflammation. And we don't like inflammation because that causes aging. And we have the perfect treatments for microbiome resetting.
What can you do about dark under eye circles? This is your favorite topic, Rachna.
Really, they're all my favorite topic. But actually, we all have dark under eye circles. Even babies have dark under eye circles, and there are multiple things that it can be caused by. It can be caused by the skin, with pigmentation. It can be caused by the contour changes. So when we age, everything starts to sag, and then we see this rim of the eye socket much more. And it can be due to very thin skin in this area, so you can see the blood vessels underneath. And we have different approaches for the individual.
What can you do about my wrinkles?
Well, I don't have to do very much about your wrinkles because you don't have very many. We start from the beginning, we start with skincare, and as people get older, if there's hooding and wrinkles, then we may think about surgery. But it's a discussion. It's a discussion that we have with you and decide what's appropriate.
Will I have to be off work for weeks? Absolutely not. We've perfected recovery to keeping it like less than a week. Actually, just a few days.
Will it hurt? Well, nothing ever that is surgical will not hurt at all, but we have lots of little tricks up our sleeve to make it as painless as possible. Will I be bruised?
Surgery can cause bruising, but we've worked very hard and meticulously to minimize the bruising. I think we probably get the least bruising possible with our surgery.
Will I look weird?
You're dealing with very sensible people here. We both have kids, families. We don't create duck lips. We make you look fresh and classy the way you did when you were younger. It's not about changing you, it's about restoring you. And that's why we called our clinic Face Restoration, because it's about getting you back to your best self.
Well, this is similar. Will I look done? No, you're not going to look done. You're going to look like a better version of yourself. Will I need
to be knocked out?
We do all of our surgery under local anaesthetic. Will I have to stay overnight? No, you don't have to stay overnight. If it's surgery, the operation takes anything between an hour for both upper eyelids to an hour and a half for all 4 eyelids. If it's not surgical, it's a non-surgical injectable treatment, then it's in office and it's done in 15 minutes.